Hello students, my name is Talşın Dalilhan Kızı. I am teacher from Department of Children's Infection Disease. Today I will demonstrate to you my lecture about bacterial intestinal infections. At first, what is a bacterial intestinal infections? It's a human disease which caused by variety bacteria with enteral or fecal-oral transmission mechanism, which characterized by lesion of the GIT tract, with syndromes of intoxication and the syndrome of diarrhea. How they classified? By severity, of course, they classified like mild, moderate, severe. By course of infection to acute, which lasts up to 1 month, prolonged up to 3 months, and chronic more than 3 months. And on the topic of defeat of our GIT tract, they classified to gastritis, enteritis, colitis, gastroenteritis, or gastroenterocolitis. First disease which during this bacterial intestinal infection or bacterial diarrhea is shigellosis, or as you know, dysentery. It's an acute infection disease caused by Shigella bacteria and mostly characterized by colitis syndrome and syndrome of general intoxication. Shigella are gram-negative immobile 6 bacteria and they of course transmitted by fecal-oral route, by contaminated food mass, by the water. Sometimes household mechanism also can occur, and Shigella by the type they classified by several serogroups A, B, C, D. There are Shigella dysentery, more famous, Flexneri, Boydii, and Zone. Epidemiology, the source of infection is mostly sick person or bacterial critters. Transmission, as I told before, food, by water, and household contacts also. The patient is danger from first day of illness, and bacterial excretion stops by the 15th day from the disease. On the clinical manifestations, shigellosis is characterized by abdominal pain, tenesmus, by spasmodic and painful sigmoid colon palpation, and of course by general intoxication sign as increase in the body temperature up to very high grades, plus myalgia, headache, general dizziness, fatigue, weakness, and etc. And by syndrome of distal colitis, or we can say them like hemocolitis. You can meet this character of the stool like rectal spitting stool. What means rectal spitting stool? The first day of illness, stool will be in the large amount, greenish or brownish color stool, with specific smell. Of course, it will abnormal with incurrence like mucus, and the last day will be with blood. At the last day, the amount of stool will be very decreased, and you can see rectal spitting, like a little amount of the feces, a lot of amount of the mucus, and the blood will present at the stool. And patient will feel tenesmus, which falls calling to defecation. Next disease is salmonellosis. It's an acute infection disease which caused by Salmonella bacteria, also characterized by lesion of the GIT tract with fecal-oral mechanism. The genus of Salmonella from the family of Enterobacteria family. They are gram-negative. They have seasonality, mostly summer-autumn period, but can spread whole year also. After illness by Salmonella, immunity is mostly short-lived. And the main sources of the Salmonellosis mostly are food products like chicken meat, meals, eggs, milk products like cheese, sour cream, and the water also, household is also can occur. Clinical manifestation of salmonellosis is characterized by intoxication syndrome and syndrome of diarrhea. Incubation period lasts from the several hours up to 3 days, sometimes can increase up to 7 days. And the patient will feel general intoxication syndrome. Sometimes salmonella can last with long-term fever, more than 7 days, and all days fever will increase to the very high grades, to febrile or gactyl temperatures, and the local change syndrome. Local change syndrome means which organ will affect it. Mostly GIT tract, but sometimes can occur septic forms, toxic forms also. And dehydration syndrome also can occur. The stool in the salmonellosis has very specific. From first day of illness, patient will have dyspeptic syndrome as vomiting, repeated vomiting. Then diarrhea is dark green color. Sometimes it can be written like swamp mud like dark green color with very specific acute smell and with a lot of amount of mucus. Sometimes blood cells also can meet. Next infection disease also from the family of Escherichia E. coli. They call Escherichiasis. They are one of the famous family of bacteria which damage our GIT tract and cause bacterial intestinal infections. The causative agent is E. coli. They are gram-negative and they produce enterotoxins and they are very stable in external environment. And the clinical manifestation of Escherichiasis mostly depends on which category of Escherichiasis are caused our disease. They are classified like enteropathogenic, enterotoxigenic, enteroinvasive, enterohemorrhagic, and enteroadhesive Escherichia. From them, more danger are enteropathogenic and enteroinvasive types of Escherichia. Enteroinvasive Escherichiasis. It's occurs mostly in the children more than 3 years old, and the presence of infection mostly with fever, with general intoxication syndrome, mostly transmission by contaminated food mass, and colitic syndrome will occur. In this disease, enteroinvasive diarrhea will be like seems like dysentery disease when a patient will feel muscle cramps, abdominal pains, and very painful spasmodic sigmoid colon palpation. And on the coprogram and on the general CBC, patient will have inflammation. Type of diarrhea is enteropathogenic Escherichiasis. Mostly will damage the patients under 2 years old. The path of infection in households less often by water, characterized by general intoxication syndrome and by watery abnormal stool up to 5, 6 or more times, and the general dehydration also can occur. Enterotoxigenic strain of Escherichiasis cause also enterotoxigenic Escherichiasis. These strains of Escherichia E. coli can damage children and adults also. The pets mostly by food and characterized by general intoxication syndrome plus by dyspeptic syndrome, mostly in more cases characterized by vomiting and can cause like food poisoning or salmonellosis disease. Also, but in this form of infection, patient can complicated by occurrence of dehydration syndrome. Next form is enterohemorrhagic type of Escherichiasis. This one of the very severe form of Escherichiasis. This E. coli produce exotoxin. And the source of infection is mostly sick person, and it proceeds form of asymptomatic form to severe, very severe pathological process with hemocolitis, bloody stool, and can development of the hemolytical uremic syndrome, and it's a very one of the danger complication of bacterial diarrhea. Next infection disease is Staphylococci enteritis or enterocolitis, mostly caused by Staphylococcus aureus. Mostly can damage children under 1 year old, characterized by lesion of the variety organ and systems. Is a patient can have infection of the respiratory tract and GIT tract of the skin and etc. If we will talk about intestine infection, most of patients will complain to constipation and diarrhea, and their feces will be mostly greenish color, with the amount of the mucus plus sometimes blood also. Next infection disease is cholera. Cholera is also one of the bacterial intestine infection caused by cholera vibrio. We know this infection disease, one of the very dangerous infection disease, because very fastly dehydration syndrome will occur to the dehydration shock. And in infection, cholera vibrio will produce toxins, will activate adenylate cyclase mechanism, and secretion of water and electrolytes will disturb. So patient hasn't any inflammation process. Without inflammation process means without fever on the normal body temperature, without abdominal pain, patient will have repeated vomiting and the watery stool in same time. And the stool in cholera, like a boiled rice water type stool, just a watery whitish color stool. So we talk about bacterial intestinal infection in children. So we must telling about diagnostics on the basis of general clinical tests like CBC. Of course, in CBC, in bacterial diarrheas, inflammation process will be like leukocytosis, neutrophiliosis, increase of ESR. On the coprogram also present of the amount of mucus, leukocytes, sometimes red blood cells also. And specific laboratory test to confirm and diagnose, of course, is bacteriological examination of the stool. And if patient have vomits, you can also take bacteriological seeding of the vomit mass also. And serological methods also can use, like passive hemagglutination reaction. We can see to the titers of antigen antibody complexes, and in the by prescriptions you can do coagulogram, biochemical analysis, and the consultation of other specialists like a surgeon and etc. No, it will be do by prescriptions. Treatment tactics. All patients with bacterial diarrhea should save diet number 16 to children under the 2 years old, elder table number 4. What means exclude or boiled junk food, fresh fruits and vegetables, mostly milky vegetable diet. And etiologic treatment using antibacterial drugs, dehydration treatment by plan ABC according IMCI program, and symptomatical therapy. Etiologic treatment of bacterial diarrhea in children mostly used if patient can swallowing, they haven't repeated vomiting. To etiologic treatment used antibacterial drug first line are azithromycin at the dose of first day 10 mg to kg, from the second to fifth day, next 4 day half dose is 5 mg to kg. In salmonellosis, second antibacterial drug can be cephalosporins of third degree, ceftriaxone at dose 50-75 mg to kg, intramuscularly, of course with probe, or cefotaxime at dose 50-100 mg to kg 3 times a day intramuscularly. Indicators of effectiveness of our treatment, of course, are normalization of body fever, normalization of electrolyte balance, clinical recovery, absence of the abnormal stool and vomiting, and negative results of bacteriological seeding. Freedom maintenance means what we must do after treatment. We must discharge these patients from hospital only after recovery and laboratory recovery also. Bacteriological examination of all convalescents. Person with chronic dysentery should be registered at dispensary by specialists on 1 year, and we must examine all persons with chronic shigellosis monthly to bacteriological seeding of his feces. That's all. Thank you for your attention. Goodbye.